PHS Lucknow. Now today we'll deal with the topic which we left yesterday, how to read an ECG. Yesterday we did about how to calculate the heart rate, and today we'll deal about the various waves in the ECG. Now what are the various waves? The P wave, the QRS complex, the ST segment, and we'll also deal with the intervals like the PR interval, the QRS interval, the ST interval and the QT interval. Now ये इंटरवल्स बहुत इंपॉर्टेंट है हमारे लिए. सबसे पहले हम ये जानेंगे कि ये जो हमारे जो ये डिफरेंट वेव्स बन रही हैं कैसे बन रही हैं. सो पहले हाउ इज़ द पी वेव फाउंड? पी वेव इज फाउंड बाय द एट्रियल डीपोलराइजेशन. नाउ व्हाट इज एट्रियल डीपोलराइजेशन? व्हेन द इलेक्ट्रिकल वेव कम्स इट डीपोलराइज द एट्रिया. तब एट्रिया डीपोलराइज होता है तभी तो कॉन्ट्रैक्ट होगा. नाउ आफ्टर दैट द वेंट्रिकल विल डीपोलराइज थ्रू द AV node and the bundle of his and the Purkinje fibers. ऐसे depolarization होगा. So what will be the next step? The ventricles will, the atria will repolarize and the ventricles will depolarize. Now when the ventricles will depolarize, early ventricular depolarization, the QRS complex will be formed. And then उसके बाद क्या होगा? उसके बाद subsequent ventricular depolarization, तो ST segment and ventricular repolarization, तो TV wave will be completed. So this forms the whole chain of the electrical and the physiological events of an ECG. Now coming to the various intervals, what is the PR interval? What is the normal PR interval? Normal PR interval is 0.1 to 0.2 seconds, that is up to 5 small boxes. Now what is the QRS complex? QRS complex is up to 0.8 to 0.1 seconds. Now I am not dealing in milliseconds so that the confusion might not arise. So I am dealing in seconds. Now next is the ST segment. ST segment का क्या ड्यूरेशन होता है? 0.8 to 0.12 seconds. Now एक very important interval है QT interval. QT interval हमारे लिए जानना ज़रूरी है because various prolonged QT interval आप आगे पढ़ेंगे. तो QT interval is almost of 10 to 11 boxes. It means 0.42 or 420 milliseconds. So you have to keep all these things in mind while dealing with the ECG, because ये फिर हमारे लिए आगे बहुत important होने वाला है various disease को जो हम आगे समझेंगे. Okay. The waves. Now you can see as you can see in the ECG, you can see now you can see this is the P wave. P. This is the QRS complex. Now this is the P wave. Now you see the first upward wave is known as the P wave, and after the P wave, the first downward deflection is known as the Q wave, and after the Q wave, the first upward deflection is known as the R wave, and then the S wave, and when the S wave moves to the isoelectric point, and from there the wave which is generated is known as the T wave.